name is Jason Schmelz. Served in the Marine Corps 2001-2005. Did 2 tours in Iraq as an infantryman, 1st Battalion, 2nd Marines. Got out in 2005, and I've been a police officer since 2007. I have a wife and 2 children.
From the time he could dress himself, he started dressing himself in camouflage. When his friends came over, they would grab their plastic guns and run around the house shooting each other and pretending like they were in wars, and the kid just was always in camo and always wanted to join the military.
The first deployment was a 2-week conflict, and then after that it was really nothing. The second time was more consistent. Nasiriyah was probably the second biggest battle in Iraq behind Fallujah, and there was a battle that lasted for a few days, and one of the biggest battles in Iraq.
He came home physically okay, but I knew as soon as he got in the car, it was just, I felt like it was that little 5-year-old in his camis again, because he just felt so broken, you know, even though physically on the outside he looked fine, I could tell something was different, and it has never been the same.
You've got people, kids in combat, whose brains are being affected by what they're seeing. It's not that kid that you sent to basic that just came out of high school. This person's very, very different. They're scarred, and they've seen and done things that most people would never imagine.
You know, I didn't feel like I gelled with people as much as I used to. It was just different. It just felt different.
You would ask him if he was okay. I could tell on days that, you know, things weren't, he was just different than other days, and some days were harder than others, I could tell, but he would always say, I'm okay, I'm okay. He really didn't get help until he met his wife, so I think she really has helped him through this, and she's still helping him through this.
First, I would say to families, don't panic. Don't panic, because there's actually help. As much as the veteran might be saying, no one can help me, there's help.
I know the Kaufman Fund is partnered up with the VA for their new mental health program, and they're also partnered with 7 other health organizations.
The purpose of the collaborative is to improve mental health access for veterans and veterans' families by bringing together both community agencies and the Department of Veterans Affairs Medical Center in St. Louis to try to coordinate services.
So when they're going to the vet center, if things are, for some of the veterans, more than maybe they want to handle or can handle, they've been a great resource.
After being out of the military for years, I started hearing about problems with other guys I was in with, as far as drinking or suicide. So when I hear about one of the guys I was in with commit suicide, I go through a number of emotions, sadness, anger, frustration.
If the veteran who is suicidal is not letting on to their buddies that this is what's going on, there's nothing that no one's gonna be able to do anything.
I feel guilt because I didn't help him enough.
We just try to build him up and just, you know, create a happy environment for him, and you know, try to know that he's loved and we're always there to support him.
For family members of veterans and veterans who are in need of mental health services, it's important to understand that there is hope and there is help.
I feel what helps the most is to keep in contact with each other and physically see each other, not just call each other or message each other, but actually physically go see each other.
When veterans get together, they know if something happens, everybody's got everybody's back. And so they can actually let their guard down and be comfortable with their, with their battle buddies, because they know if anything happens, we've all got each other's backs.
When you go do that, you feel a lot better for a long period of time.
At another level though, you also have to learn how to deal with civilians who don't necessarily know how to have your back. My goal is get out there and live, go anywhere you want, whenever you want, comfortably. Once I know that they're able to go do these things comfortably, then you're good. It doesn't mean that you will never have a symptom ever again in your life, but you'll understand what's going on and you'll know how to actually deal with it, not cope with it, but you'll know how to actually take care of the actual problem so you don't have to cope with it.
If you see a family member struggling, especially a veteran, just reach out to them, let them know they're not alone, and Now they have a new resource, the Kaufman Fund, they can reach out to. I'm really excited about that new mental health program.
I encourage people, as a first step, if you're just trying to figure out what do I do, where do I go, I think one of the first things you can do is actually contact the Kaufman Fund to get some direction.
Now that I'm aware of the Kaufman Fund, to know more about it, I feel more prepared and I'm willing to help other veterans.
I just want to thank the Kaufman Fund for everything they've done for veterans. They work 24/7, they never stop, they always answer their phone, and they are always there for you, so please don't hesitate to call them if you need help, especially mental help.
Please contact either the Veterans Association or the Kaufman Fund. We'll be able to help you find the services that you need.